Good morning, and thank you very much for coming to Toronto Police Headquarters. Today, I'd like to introduce to you Chief Mark Saunders of the Toronto Police, the Acting Chair of the Toronto Police Services Board, Uppala Chandrasekera, the Executive Director of the Empowerment Council, Jennifer Chambers, and Inspector Chris Boddy. Together, they will be speaking about the launch of the Toronto Police Services Mental Health and Addictions Strategy. Chief.
Good morning. Thank you for being here. The health and safety of each of our members of the Toronto Police Service and those in the public that we serve and interact with is a priority for the board and for the command. I'm pleased to be here today alongside Acting Board Chair Uppala Chandrasekera to launch the Toronto Police Service's Mental Health and Addiction Strategy. The strategy is rooted in the objectives of our modernization approach in several ways, including policing in a large, complex, and dynamic city, and it places emphasis on neighborhood policing and building partnerships at a community level. The strategy has been developed over the last 3 years and has been informed by recommendations of the board's mental health subcommittee, as well as the board's mental health external advisory panel. And although our work began on the strategy more than 3 years ago, our approach will continue to evolve to ensure that we're responding effectively to our community and members' needs with the latest research and information that's available to us. We will continue to work with those members of the community who have helped us with this strategy, including Mr. Hamlin Grange, who co-chaired the Mental Health External Advisory Panel. We are very fortunate to have had tremendous support and expert advice that was always available to us. As a service, we have a long history of working with community partners, and we draw on those relationships to help develop this strategy. We sought participation from community members with lived experience for guidance on how to best interact with and assist involving individuals who may be experiencing mental health or addiction issues. Additionally, we received input from those who care for and support people with mental health and addiction concerns. Our new mental health and addiction strategy outlines the actions we will take to ensure we are responding appropriately and effectively to community members who appear to be experiencing mental health or addiction issues. The service is committed to incorporating best practices and learning from our past. The strategy, which will be available on our website, outlines 8 areas of commitment: preserving life, providing leadership, cultural competence, equity, and anti-racism, ensuring a stigma-free environment, continuous learning, advocacy and partnerships, evaluation, and transparency, accountability, and reporting. Each of the commitments mentioned here accompanied by the comprehensive set of action items that will assist the service in fulfilling our commitment of the strategy. It is our roadmap to success. It is essential that our members have the training and information they need to safely and respectfully respond to the needs of people during a moment of crisis. Officers need to be informed to be able to make the appropriate decision in a moment in a way that meets our strategy's goals in preserving health and safety and zero death. Our service has recognized a possibility for a rise in mental health-related injuries, including operational stress injuries and post-traumatic stress disorders, and the consequences that it has on those individuals, their family, their friends, and their colleagues. We are committed to supporting them to provide support to our members when they need it, and to embrace them back to work in a safe and respectful environment. We will continue to build the capacity on our members to recognize risks and connect with each other and ensure our members have the right resources at the right time in order to best do our job for the City of Toronto. I offer my thanks to those experts and members of the community who have taken so much of their time to help us develop our strategy so that we will be meaningful and effective, both in communities that we serve and for ourselves as members of the Toronto Police Service. With that, I would now like to introduce our Acting Chair of the Toronto Police Service Board, Ms. Uppala Chandrasekera.
Thank you, Chief. Thank you all so much for being here today. On behalf of the Toronto Police Services Board, I am very proud to be here today as the Toronto Police Service releases its very first mental health and addiction strategy. As a board member, as well as the co-chair of our newly established Mental Health and Addictions Advisory Panel, I'm especially honored to be here as we embark on this critically important new chapter in responding to one of the most important priorities in our community. The timing of this release is significant, as today is the start of Mental Illness Awareness Week, which is an annual national public education campaign designed to help open our eyes to the realities of mental health and addictions issues in Canada. This mental health and addictions strategy has been the result of years of dedicated effort, considerable community consultation, and a distinct recognition that how our police officers respond to people with mental health and addictions issues is one of the most important priorities for our organization and for our city. The impetus of this strategy came from the key recommendations made in the 2016 report from the board's Mental Health External Advisory Committee, which was an independent group of mental health leaders. Their recommendation was unanimously endorsed by the board and strongly supported by the service. This strategy was also developed in close consultation with the board's former mental health subcommittee, a group of committed individuals from across the mental health and addiction sector, as well as the Toronto Police Service, as well as the board representation. This strategy lays a solid foundation for a wide-ranging and evolving people-focused approach, which incorporates a comprehensive system of data, measurement, and the clear articulation of operational outcomes. Importantly, this strategy is rooted in the goals and the objectives of the Way Forward, which is the board and the service's action plan for modernization, including embracing partnerships to create safer communities and reinforcing a commitment to the principles of organizational transformation with an emphasis on neighborhood policing and connecting people to the appropriate services in their communities. It's important to note that this strategy does not only support members of the community, it also places a necessary emphasis on the mental health and wellness of the members of the Toronto Police Service. Our members are faced with the most difficult, intense, and challenging situations on a daily basis. It is critical that we not only continue to put into place the relevant programming and initiatives to effectively support workplace mental health, but also that we continue to encourage the cultural shifts necessary to remove stigma and inspire dialogue. The report released last week by the expert panel on police officer deaths by suicide, commissioned by the Chief Coroner of Ontario, reinforces the need to focus on the wellness of our members, providing concrete recommendations for suicide prevention, including strengthening mental health supports, identifying risk factors, and normalizing conversations about mental health issues, especially in the workplace. An important feature of our strategy is that it has been developed not as a standalone document, but rather as an evolving and dynamic process that can grow and change in response to new and emerging information, such as the important recommendations from the coroner last week. This vital strategy builds on the expertise of our renowned training college and its commitment to the principle of de-escalation, and recognizes the remarkable day-to-day dedication of our frontline officers, as well as the excellence of initiatives like the innovative and collaborative Mobile Crisis Intervention Team program, which partners a mental health nurse and specially trained police officer to respond to mental health and substance use-related crisis situations. This strategy also demonstrates our sincere and robust organizational commitment to both serving and protecting the people of Toronto every day. As a board, we are committed to ensuring that this strategy charts our way forward in the years to come. I have a very long list of people I want to thank and acknowledge for their contribution to this important strategy. Firstly, I want to thank the service members who have been integral to the development of this groundbreaking document, including Deputy Chief Barb McLean, who's here today, and Deputy Chief Peter Ewan. I especially want to thank Inspector Chris Boddy, who has worked tirelessly to ensure that we capture voices from across the community throughout this process and developed a strategy that truly meets the expectations of the public in a comprehensive and compassionate way. I want to thank my colleague Candice Venna, who's here from the Canadian Mental Health Association, Ontario, and Victor Kwong from the Toronto Police Communications team for their meticulous editing and design of this document. The final product looks so amazing because of the two of them. I want to thank members of the public who contributed to the development of this strategy. I especially want to thank the members of the board's previous mental health subcommittee, many are who are here today, who contributed their thoughts and ideas throughout this process, giving their time and energy in support of this important work at the Toronto Police Service over the past 10 years. I also want to thank members of the board's new Mental Health and Addictions Advisory Panel, also who are all here today, including my fellow co-chairs Jennifer Chambers and Steve Lurie. This panel consists of Toronto Police Service members and community members all working together. Thank you all for your commitment to supporting the service and the board as we move forward with implementing this important strategy. I want to thank our former board chair, Andy Pringle, for being a champion for this important work. I want to thank our wonderful board office staff, especially Ryan Teschner and Sandy Murray, as well as Fred Fisher, Jane Burton, and Scott Nowoselsky from City Legal for your ongoing support to the board on this work. And most importantly, I want to thank Chief Saunders. Thank you, Chief, for your leadership in ensuring that the interactions between the police and individuals in crisis are characterized by understanding and compassion, and for your willingness and for your bravery to shine a light on the mental health challenges that service members face on a daily basis. Today is a very good day. It's a hopeful day. While the challenges we face in responding to mental health and addictions issues are significant and sometimes feels very overwhelming, this initiative and this innovative strategy released today presents a crucial roadmap for comprehensive and compassionate response. Thank you very much. Now I'd like to call upon Jennifer Chambers to share some remarks.
Good morning. I'm proud of the Toronto Police Service for adopting this mental health and addiction strategy. It's here to preserve the lives, well-being, and dignity of people in crisis in Toronto, including police officers who have crises just like other humans. It's based on a recognition that how police treat people matters deeply and matters not only to the person but to the person who loves them, and it will go on mattering long after the police have actually gone. Unbiased policing and de-escalation are identified as primary goals when relating to people in crisis and are considered a job skill priority. Because of the inclusion of the voice of people who've experienced crisis, this document reflects an understanding of the broader context in which crises occur. Without social justice, equity, and basic human needs being met, not to mention access to affordable therapy, crises are not going away. It helps to relate to a person in crisis if you have some understanding of what it could be about. This is how de-escalation is possible. There's a promise in this strategy to keep listening to people with lived experience of mental health and addiction issues. And you know I'll be holding the service to it. We hear a lot about devastating events like the death of Sami Yatim or Andrew Loku. It's important that we understand tragedies and learn from them. We hear much less about the heartening tales of kindness of police toward people in crisis and how some service members have risked their lives to save the lives of people in crisis. But these stories are also important. I believe that effective change is not just about telling people what not to do, it's also about rewarding and inspiring great work. I think this strategy does that. The strategy is the pathway, it's not an end result, and it will require commitment to follow the path set out and continue to set higher goals. Personally, I look forward to a couple of the We Will Explore statements becoming the We Will Find statements, but we did torture some words endlessly, and we do have a good path. The transparency and accountability called for in this document means we can all evaluate its progress. And we will, won't we? I saved all the acknowledgements to the end, as I knew otherwise they'd take up all of the time I have allotted. I was going to say this happened because of all the people who were committed, but in the mental health context, that could be misconstrued. But when you think about it, it's true both ways. The original Mental Health and Addiction Subcommittee of the board, co-chaired by Pat Capone, formed under Chair Alok Mukherjee, worked with Mike Federico, Peter Lennox, and the constant quiet competence of Sandy Murray to get the ball rolling. Chris Boddy's first draft of the strategy was an excellent piece of work. Then he consulted. After putting up with me, there's a vast array of other opinions to contend with, and of course I wasn't done. Poor man, I have a picture of him with as many versions of the strategy as occupied the entire Police Services Board table. The Mental Health and Addiction Committee of the Board had to wend a path through a thicket of perspectives while also not violating our own standards, which varied, to come up with a more or less agreed to draft, and I appreciate everyone who sat around that table. It was a good day for people with mental health and addiction issues in Toronto when Uppala joined the Police Services Board. I appreciate the board and former Chair Pringle for supporting the development of two panels, the Mental Health and Addiction Panel and the Anti-Racism Advisory Panel. I didn't see this strategy for a few months, and I would admit I was a little afraid of how it might reemerge. But I thank and commend Chief Saunders, the one person whose rank I can remember, for his obvious insistence on a meaningful standard for how people in crisis are going to be treated in this city. I'm going to thank the deputy chiefs as well. Well, I don't know exactly what they did when the strategy was being discussed in the last few months. I've heard them on the panels, and they never suppressed the community voice. We have a fabulous collection of people on the new Mental Health and Addiction Panel, community and Toronto Police Service members, and we'll be working on implementing this strategy. In less than a year from now, we'll report on its progress. I hope it will be a celebration, and I hope you'll all be there. Thank you. Introducing Chris Boddy.
Thanks very much, Jennifer, for being here. Just want to remind everybody that Jennifer's been working with the service for over 20 years to help inform our police officers interacting with people in crisis in the City of Toronto, so I want to especially thank her. So happy to take any questions as it relates to the strategy. And that's okay.
I have questions.
Yeah.
If you could maybe delve into more details of the commitments to the equality and anti-racism section of the strategy, that'd be great.
Right, so we're still working on the exact logistics around that. You'll see in the document the commitments that the service has made, and it's an ongoing living document. So a year from now, you'll see the work that we've done and with regards to that. But I just want to remind everybody how important this document and this work is. Every year in the City of Toronto, police respond to over 30,000 calls for people in crisis. So 80 times today, there's going to be police officers attending calls for service for people in crisis. And people call police because there's a safety issue involved in that. So this is why this is so important. So it highlights the work and the commitment that the service and the board has for not only our interactions with people in crisis, but also the wellness of our members.
A question for the chief. Last week, the chief coroner's report on police suicides mentioned that stigma was still a huge issue within policing when it comes to mental health. And to touch on what Chris said, he said that a lot of the calls that officers get are for mental health calls, but people in the highest of crisis. And officers sort of associate that with mental health, not day-to-day changes or personal things. How do you get your officers and your frontline staff to recognize what mental health actually is and to seek help long before it becomes an issue?
Well, there are a couple of layers to that. First, it deals with what we've learned in the past. There are things that we needed to improve upon. And so through the training pieces, not just the at the table train, but also the practical training and then the debriefing to make sure that the thought processes were right, having an understanding, learning through our experts. I mean, we've got Uppala, who is an expert when it comes to mental health and that discussion. So she's very live to it and always has the ability of seeing our reports and things that we do and questions and challenges. And the third piece really is just to continue to have that ability to listen. The one thing that we've learned, and I think that Jennifer touched on it, the amount of iterations that it took to get to the final product, which means it's not necessarily right the first time, but are you as an organization open to listening to additions? Are you willing to change your behaviors? Are you willing to change your training? So these are all factors that you have to put together in order to get it right. And we've made it very clear that we're very open to that because we do want to get it right. And it's going to be a continuous process. We're going to be continuously learning, developing, growing, building out on this report. And Uppala, if you want to.
I think it's important to keep in mind that the stigma around mental health issues exists everywhere, right? 1 in 5 Ontarians will experience a mental health issue within this year alone. And so in the police service, there are some robust programs in place to support our members, led by Deputy Chief Barb McLean and the wellness team. There's a team of psychologists on staff as well to ensure that we are talking about mental health issues within the service. And as the chief mentioned, this is also an ongoing conversation at the board, so that every report, every initiative that we see at the board level, we're asking these questions so that it's a top of mind. Because the reality is, 80 crisis calls a day in this city for the Toronto Police Service, and that also means that 80 times a day police officers are responding to these types of emergencies that absolutely will have an impact on their mental health.
It says here that the service will publish the results of a member wellness survey, so what sorts of things would members be asked, and where will that be published?
So that'll be published on our website, and we'll report out publicly on that. Some of the things that we'll ask is, how do you feel that the service is supporting its members, or do you feel like you're being supported by the service, or there's things that the service can do more of, things along those lines. But I'll just add one more thing about the importance that wellness is to the Toronto Police Service. You may know that every year, every police officer attends our college, which is referred to as the in-service training program, where the officers requalify on their use of force, but they're also taught a number of different things. And every single year, there's a 90-minute module on officer wellness, and that gets changed every single year. And I've done it, I still go to it too. So every 12 months, officers get some kind of training or information around wellness, and that happens every 12 months. So every single police officer that you see on the road takes this very important training. So this isn't something new. We've been talking about this for a long, long time.
In general, have you been finding that the mental wellness of officers has been declining, or has it stayed relatively the same over the past, let's say, 5 years, 10 years, however you gauge it?
Yes, I'm not probably the one to talk on that, but I can say anecdotally that officers are much more aware of mental health, much more aware of fitness than they were 30 years ago when I joined them, that's for sure.
Question for the chief? Sorry. Last week you tweeted out that 53 people on bail were reoffended for firearm charges, A criminal lawyer reached out to City TV and is challenging your numbers. He says that in all of 2019, out of 43 people out on bail for firearm charges, at his large firm, only 4 reoffended. How do you account for the discrepancy in numbers?
Well, my numbers would be coming from the stats that we have gathered. I don't know where he has gathered his stats, and I don't want this to be a push and pull. I'm speaking to the project that we have on the go and the things that we have noticed, and we've been tracking it. So we've been looking hard at that specific aspect of the project to see the bail and does it have impact. And so, as I stated before, I'm not pointing fingers at people. I'm saying, do we need to have a discussion on whether or not this is the way things should be? Or when it comes to people that are on firearms charges, is there a further discussion that needs to take place?
So then, Chief, you must have been pretty happy with what was presented by Andrew Scheer this week and his crime bill.
I'm staying clear of that lane. I'm going to stay as a chief of police. It's a good day to be here in this environment to talk on what we're doing on the go forward on how we as an organization are going to improve on how to address people in crisis. And I'm looking forward to the commitments that we've made to make sure that we can be better as a police agency.
Are there any more questions?
All right, thank you very much for coming. This ends our conference. The news release will be going out shortly if it hasn't already, and there will be a link to the mental health and addiction strategy. Thank you for coming.